Picture this. It's about 8:30 on a Tuesday night.
Oh, I already know where this is going.
Right. You're sitting on your couch. You've got a show playing in the background. You're finally, just unwinding from the day. And then your phone lights up.
The dreaded email notification.
Exactly. The subject line reads, "New test results available in your patient portal."
And your stomach just instantly drops.
Instantly. Your heart rate spikes. You click the link. You have to fumble through that two-factor authentication text message just to log in.
Which always takes way too long when you're panicked.
Always. And suddenly you're staring at this glaring white screen full of medical jargon, numerical values, diagnostic codes, and your doctor hasn't called you yet because, well, it's after hours.
Oh, they're home.
Yeah, so it's just you sitting alone in your living room trying to frantically Google your way into deciphering your own fate. I mean, it is the absolute definition of a modern anxiety trap.
It really is. It's an incredibly isolating experience, and, it's happening to millions of people right now.
Yeah.
Because we are living through this major push for medical transparency, which, on paper, is a fundamentally good thing.
Sure, yeah.
I mean, patients absolutely should have access to their own health data. But handing someone raw, unfiltered medical data without any professional context, it's basically a recipe for instant panic.
Completely.
And that panic is taking on an entirely new, incredibly complex dimension because we're suddenly dropping artificial intelligence right into the middle of it.
And that exact scenario, logging into a portal and seeing AI data sitting right alongside your doctor's notes, that's the focus of this really fascinating new study we're doing a deep dive on today.
Yeah, it's a great one.
It was published in the Nature Partner Journal, NPJ Digital Medicine, and it was put together by researchers from Brown University and Seoul National University.
Right.
And they specifically looked at mammograms. Like, what happens to a patient's psychology when they see an AI's interpretation of their scan sitting literally right next to their human doctor's report?
And we should clarify, this is not some far-off sci-fi hypothetical thing.
Oh, not at all.
The FDA has already approved several AI tools for breast imaging. Hospitals are using them right now to triage exams, detect lesions, assess breast density, all of it.
It's already here.
It's here. And because of that movement toward total healthcare transparency we just mentioned, patient portals are essentially obligated to show you this information.
Right, because ethically speaking, if an algorithm is analyzing your body, you have a right to know what's happening.
Exactly. You have the right to know. But the problem this study tackles is the delivery of that knowledge. Like, does throwing that raw AI data directly at a patient on a Tuesday night actually backfire?
Okay, let's unpack this, because the way they designed the experiment to answer that question is just so clever.
It really is.
They isolated the exact moment of conflict. So they surveyed 1,623 English-speaking women in the U.S., and all of them had undergone at least one prior mammogram.
Which is key, right?
Yeah, completely key. So they were talking to an audience that already intimately understands the baseline inherent stress of breast cancer screening.
Right. They understand the stakes. This isn't abstract for them.
No, not at all. So the researchers set up this very specific hypothetical scenario for all of them.
Right. So every single participant was shown a BI-RADS 1 radiologist report.
And BI-RADS is just the standard score system for mammograms, right?
Exactly, yeah. And a 1 means negative. So in plain English, the human doctor reviewed the scan and found absolutely zero evidence of breast cancer.
Okay, so it is a totally clean bill of health from a human expert.
100%. But then they split these women up into 13 different groups to see how varying levels of AI input would, mess with that peace of mind.
Right, because one group was just the control. They only saw the human doctor's negative report. Boom, you're fine, close the laptop, go to sleep.
The dream scenario.
Right. But the other 12 groups saw that exact same human doctor's report, accompanied by a second report generated by an AI tool. And the researchers manipulated what that AI score said.
Right, so they established a 1 to 100 scale for the AI with an abnormality cutoff threshold set at 30. So anything under 30 is considered fine, and anything 30 or above triggers a suspicion of cancer.
Got it.
So the participants were shown one of 4 specific AI scores. They either saw a 0 or 29, which means the AI completely agrees with the human doctor that you are safe.
Right.
Or they were shown a 31 or a 50, meaning the AI openly disagrees with the human doctor and is actually flagging a potential tumor.
It totally reminds me of driving a rental car with two GPS systems running at the exact same time.
Oh, that's a perfect way to put it.
Right, because you've got the car's built-in navigation, which is like the trusted human doctor telling you to just stay on the highway, everything is clear.
Smooth sailing.
Exactly.
Yeah.
But then you have this experimental app on your phone, the AI, suddenly flashing red and screaming at you to pull the emergency brake and swerve across 3 lanes of traffic.
And as a driver, you're just paralyzed.
Completely paralyzed. Who do you trust? And I guess more importantly, what do you do next?
Well, what's fascinating here is that paralysis is exactly what the researchers were probing, but they actually took it a step further.
How so?
They weren't just asking these women to rate their anxiety on a scale of 1 to 10. They were measuring hypothetical actions, specifically their inclination to file a medical malpractice lawsuit.
Wow, lawsuits.
Yeah. They wanted to understand the human factors in healthcare and how AI might drastically alter the legal liabilities of human doctors.
And the scenario they use to test this is just, I mean, it's a nightmare.
Oh, it's bleak.
Yeah. They asked the participants, imagine it's exactly 1 year later. You go back in for your next annual mammogram, and the doctors find advanced stage 3 breast cancer.
Just devastating.
Right. And the question is, would you consult an attorney to sue that original radiologist from a year ago for missing it?
It's the ultimate worst-case scenario for the patient who is now dealing with a severe diagnosis and the physician who is facing a career-altering accusation.
Right. Now, in the control group, the women who only saw the human doctor's clean report and never saw any AI data, about 39.7% of them said they would consider suing.
Which honestly makes sense.
Yeah, I mean, a misdiagnosis of that magnitude is a massive deal. So that establishes our baseline for, like, human-to-human medical reality.
Right, around 40%.
But the moment you introduce the AI, the numbers just completely detach from reality. Let's look at the group that saw an AI score of 31.
Right, and remember, the danger threshold is 30.
Exactly. So this is the machine just barely crossing the line to flag a suspicion of cancer, directly contradicting the human's clean report. In that group, the desire to sue the human doctor spiked to 60.7%.
I mean, you're talking about a massive, terrifying jump in legal liability.
Huge.
An increase of over 20 percentage points, entirely generated by a patient seeing a single marginal number produced by a machine.
It's wild.
It immediately overrides their faith in the human expert.
Hold on, though, because there's a piece of data here that totally breaks my brain.
Oh, I know which one you're talking about.
Like, if the machine contradicting the doctor makes you want to sue, fine, that tracks. But what happens when the machine validates the doctor?
This is where it gets weird.
Right. Because the researchers had a group that saw an AI score of absolutely 0, a perfect 0 suspicion score from the machine, entirely agreeing with the human radiologist.
That's perfect consensus.
Yet, in that group, the likelihood of considering a lawsuit a year later still went up. It crept up to 46.9%, which is noticeably higher than the baseline of 39.7%, where no AI was present at all.
Yep.
Why on earth would seeing a machine perfectly validate my doctor make me more likely to sue them later? If anything, I feel like I should feel doubly protected.
It feels entirely backward, I agree, until you dig into the psychology of how we perceive safety nets.
Okay, explain that.
The very concept of looking for abnormal findings is inherently anxiety-inducing, right?
Sure.
So when a hospital introduces an AI interpretation into your patient portal, even if it spits out a perfect score of 0, they are actively reminding you that a machine was required to double-check the human.
Oh, wow.
It introduces the concept of human fallibility into the patient's mind where it might not have existed at all.
So just by showing me the AI, the hospital is inadvertently saying, hey, your doctor's pretty good, but we bought this $1 million software just in case they miss something.
Precisely. You are planting a seed of doubt. The patient realizes that the human expert is capable of failure, hence the need for the machine.
That makes so much sense.
And once that seed of doubt is planted, it just grows. If something goes wrong a year later, the patient doesn't think, well, both the doctor and the AI missed it. Breast cancer is just incredibly hard to detect.
Right.
I think the doctor must have been so negligent that even the safety net couldn't save them.
That is fascinating. You literally can't unring the bell of anxiety.
You really can't.
Once I know the machine is watching the doctor, I'm permanently going to wonder if the doctor actually needed watching.
Exactly.
And this psychological burden, it doesn't just sit quietly in the patient's mind, it demands immediate action. The study tracked how this anxiety translates into what they call checking behaviors.
Right, because if you see an unsettling number on your portal, You aren't going to just close your laptop and peacefully go to sleep.
No
They're
way.
going to try to resolve the uncertainty.
Here's where it gets really interesting. Because the researchers measured 4 specific behaviors, right?
Right. Wanting to seek a second opinion from a completely different radiologist, asking for a second look from the same radiologist, booking a visit with your primary care physician, or demanding more accurate follow-up imaging, like an MRI.
And the introduction of AI didn't just, like, slightly increase these behaviors. It caused them to absolutely explode.
The magnitude of the jump is what's truly alarming from a structural standpoint.
Let's take the desire for a second opinion. When no AI was involved, only about 8% of women felt the need to get a second opinion after their doctor gave them a clean bill of health.
Which is pretty low.
Right. But if the AI portal showed that score of 31 again, just one tiny point over the threshold, that demand multiplied by nearly 10 times. It shot up to over 70%. 7 out of 10 patients suddenly demanding another doctor's time.
And it happens even when the machine is technically in the safe zone.
Right.
If the AI gave a score of 29, which is under the threshold, and officially means no suspicion of cancer, the desire to have the original doctor take a second look jumped from 14% to over 62%.
Wow!
Even when the machine agrees that you're fine, the simple fact that it got close to the edge is enough to break your trust.
I mean, I keep thinking about this like the check engine light on a dashboard.
Oh, yeah.
If you're driving and that light flickers on for just 3 seconds and then goes away, what do? You take it to the mechanic.
You have to.
Right. The mechanic plugs in his diagnostic tool, looks under the hood, and says, look, I've checked the belts, I've checked the transmission, the car is totally fine. It was just a sensor glitch.
But you're still gripping the steering wheel the entire way home.
Exactly. You turn the radio off so you can listen for weird engine noises. You might even take it to a second mechanic later that week, because the human expert told you it's fine, but you just can't unsee the light.
And if you scale that check engine light effect up to an entire healthcare system, the downstream implications are catastrophic.
Oh, I bet.
We are already dealing with massive shortages of healthcare professionals. We do not have enough radiologists to handle the current baseline volume of scans.
So if a hospital implements this AI and suddenly every minor flag or even sub-threshold score causes a 10-fold increase in patients demanding second opinions, MRIs, and primary care visits,
the infrastructure simply collapses.
it just can't handle it.
It absolutely buckles under the weight. You would see an unprecedented spike in healthcare expenditures and skyrocketing imaging volume. But the real tragedy is the human cost.
Because of the wait times.
Exactly. If the system is flooded with panicked patients demanding second opinions for benign, false alarm AI flags, the wait lines stretch from weeks to months. The patients who suffer are the ones with actual, confirmed cancers who desperately need immediate life-saving care, but are now stuck in a queue behind a wall of AI-induced anxiety.
Oh, man. So the portal, which was supposed to empower patients, essentially grinds the hospital to a halt and terrifies everyone in the process.
Right.
If human psychology makes us spiral every time an algorithm flags an anomaly, how do we fix the portal without just turning the AI off entirely?
Well, the study actually tests a solution.
Right, and it comes down to providing the right kind of statistical context.
Yes. The researchers wanted to see what would happen if they didn't just hand patients a scary, isolated score, but actually took the time to explain the machine's inherent limitations.
Okay.
They introduced a metric called the false discovery rate, which we can think of as the false alarm rate.
And for this specific AI tool, the false alarm rate was 95%.
Right.
And they also measured the false omission rate, which is basically the miss rate. That was tiny, just 0.2%.
Very small.
Now, when they took that massive 95% false alarm rate and put it directly on the portal next to the scary AI score of 31, the panic essentially evaporated.
Just vanished.
The intent to sue the doctor plummeted from nearly 61% all the way down to 31.6%.
Which is actually lower than the baseline control group that saw no AI at all.
Right. Showing the false alarm rate also drastically wiped out those massive demands for second opinions and extra doctor visits.
It completely neutralized the panic response.
But wait, I have to stop here because the math of this is wild.
It is, yeah.
A 95% false alarm rate means the AI is wrong 19 times out of 20 when it flags a scan as suspicious.
Exactly.
If I bought a smoke detector for my house and 19 times out of 20 it went off because I was boiling water instead of actually having a fire, I would throw it in the garbage.
Oh, absolutely.
Why on earth would any hospital spend millions of dollars on a medical tool that is wrong 95% of the time?
Because a medical screening tool is fundamentally different from a diagnostic tool. In screening, especially for something as aggressive and critical as breast cancer, you intentionally tune the machine to be hypersensitive.
Okay, so how does that actually work in practice?
Think of the AI like a guy walking the beach with a metal detector, looking for a lost diamond ring. Because the ring is so incredibly valuable, he turns the sensitivity dial on the metal detector all the way up to maximum.
Right.
Now, that detector is going to beep at every single soda can tab, every piece of foil, and every rusty nail buried in the sand. 95% of the time it beeps, it's a false alarm, it's garbage.
Right.
But he keeps the dial cranked up because he absolutely cannot afford to walk over the diamond ring without the machine making a sound.
Ah, I see. So that incredibly low miss rate, that 0.2% false omission rate, that's the trade-off.
Yes,
If the metal detector stays silent, you know for a fact the diamond isn't there.
exactly. The AI casts an incredibly wide, highly sensitive net. But you don't just dig up the whole beach with a backhoe every time it beeps.
You destroy the beach.
Right. The human doctor is the expert with the trowel, sifting through the sand where the machine beeped, looking at the evidence, and confidently saying, no, that's just a soda tab. Or in this case, that's just dense, normal breast tissue, not a tumor.
Wow, so the machine is designed to be paranoid so the human doesn't have to be.
Beautifully put, yes.
That's right.
And what the study proves is that when you explain this dynamic to the patient, when you show them that 95% false alarm rate, it grounds them in reality.
Yeah.
It completely shatters the cultural illusion we have that AI is this omniscient, infallible oracle.
Because we do. We tend to think of algorithms as perfect calculators.
Always.
But by showing the error rate, you're essentially pulling back the curtain and showing the patient that the AI is actually just an incredibly anxious assistant.
Exactly.
And the study highlighted a psychological phenomenon here, right? Something about how our trust shifts when machines make mistakes.
Yes, the researchers linked this back to a concept established by Dietforst and colleagues called algorithm aversion.
Algorithm aversion, okay.
Human beings inherently hold machines to an impossible standard of perfection, especially in high-stakes decisions like healthcare.
Right.
We might trust an algorithm initially, but the absolute second we see it make a mistake or we learn about its high error rate, our trust in it collapses entirely. We are far more forgiving of human error than machine error.
Oh, that makes sense. So by putting that 95% false alarm rate on the portal, you are strategically triggering algorithm aversion.
Yes.
You're telling the patient, look how often this fancy new robot gets it wrong. And by devaluing the machine, you inherently elevate the human.
Exactly.
The patient looks at the portal and says, thank goodness I have a human doctor here to filter out all this machine noise.
It perfectly restores the patient's trust in their human physician.
It's a great fix.
It is. But as encouraging as that solution is, the study takes a very sobering turn when we look at who actually gets to utilize these portals.
Yeah, this part was tough.
Because if a patient gets that scary AI alert and they don't get the statistical context, their immediate reaction is to want follow-up care. But wanting it and getting it are two very different things.
Right. This is where the study shifts from human psychology into brutal financial reality.
Yes.
They asked the patients who wanted those second opinions or extra MRIs what would actually dictate their ability to get them. And the results are heartbreaking.
Truly.
About 2/3 of the respondents who wanted follow-up services said they would only do it if they didn't have to pay out of pocket.
And the distinction they made there is critical.
Yeah.
The survey asked them to clarify their reasoning. They didn't just say, oh, I just don't feel like spending the money. They indicated actual financial inability.
Unaffordability.
Wow.
They literally did not have the means to pay for their own peace of mind.
So what does this all mean? It points to a really tragic irony in this whole system.
It really does. Because the entire point of patient portals is to democratize data. We want everyone, regardless of their background, to have their health information at their fingertips.
Right.
But if you drop an unfiltered, terrifying AI score onto a patient's phone, the ability to act on that terror remains locked firmly behind a paywall.
And if we connect this to the bigger picture, the study authors explicitly warn about this. Marginalized populations already bear a disproportionate burden of cancer morbidity and mortality due to social determinants of health.
Right, things like lack of insurance, lower socioeconomic status, and systemic inequities.
Exactly. So if you are wealthy, A false alarm from an AI on your portal is basically just an inconvenience.
Yeah, you just call a private clinic, you pay out of pocket for a rapid MRI, you get the all clear, and you move on with your life.
Right. But if you are lower income, that exact same AI flag could cause massive, paralyzing psychological distress.
Because you have the terrifying data, but you literally cannot afford the reassurance of a second opinion to tell you it's just a false alarm.
Exactly. We aren't democratizing healthcare, we're just democratizing anxiety.
Man, it totally reframes the conversation around the future of medicine.
It does.
It's no longer just about building the sharpest, most sensitive AI metal detector. It's about how you deliver the AI's message to the patient holding the shovel.
Because the communication is the care.
Yeah. So to pull all of this together, we've learned today that raw transparency is not automatically a blessing.
Far from it.
Dropping unfiltered AI scores into a patient portal on a Tuesday night can trigger massive panic. It can collapse hospital infrastructure by spiking demand for unnecessary tests and drastically increase the threat of lawsuits against human doctors, even when the machine agrees with them.
Which is still so wild.
But there is a very practical cure. Giving patients the actual statistical context, like triggering that algorithm aversion by being honest about the machine's high false alarm rate that empowers the patient, dissolves the panic, and ultimately restores their faith in their human doctor.
Yes. And as we navigate this transition, there's an even bigger question this leaves us with.
Yeah.
We spent all this time talking about hospital portals, but AI is rapidly escaping the clinic.
That's true.
It's being integrated into the devices we wear on our bodies every single day. Our smartwatches, our fitness rings, our phones, they are constantly feeding us raw health data.
Heart rate variability, blood oxygen, all that.
Right, sleep disturbances. At what point does giving us more real-time data actually strip away our control over our own peace of mind?
Wow.
If statistical context is the only cure for AI-induced anxiety, how do we force massive tech companies to provide the necessary medical context on our wrists and not just the terrifying vibrating alerts?
That is a lot to think about. I know the next time my watch buzzes to tell me my resting heart rate is slightly elevated while I'm just sitting on the couch, I am definitely going to be picturing that guy on the beach with the metal detector.
Let's hope so.
Well, thanks for joining us on this deep dive. We'll catch you next time.